As the U.S. passes that 200,000 death milestone, here's what the president says about where we're headed.
We're rounding the corner. With or without a vaccine. They hate it when I say that, but that's the way it is. We're rounding the corner on the pandemic, and we've done a phenomenal job, not just a good job, a phenomenal job, other than public relations, but that's because I have fake news. I can't, you can't convince them of anything. They're fake. But we have done, on public relations, I give myself a D. On the job itself, we take an A+.
NBC News senior medical correspondent Dr. John TORRES joins us now. Dr. John, what's your reaction to that? Do you think we're rounding a corner?
God, I don't think we're even close to rounding the corner. When he talks about weeks, my take on it is we're talking months before we start getting things under control, and that's going to take a concerted effort of a bunch of different things. The vaccine, which we're looking at getting beginning of the year, maybe springtime, but before it starts getting into everybody, the general population, maybe even early summer at that point, that's one of the things that's going to take it to get under control. And if you look right now, there are 18 states that have increased cases, and so that's not getting it under control. That's not rounding the corner. And then if we expand this worldwide, they're having a lot of issues around the world as well with other areas and other countries. And since this is such a small world, that can certainly spread over here as well. And we keep hearing about this first and second wave. We're still in that first wave, Gotti, have not gotten it under control. We're still averaging around 40,000 cases a day. To get it under control, we need well under 10,000 cases a day, according to some of the experts. We're not even close to being there yet. And so to say we're rounding the corner, we're starting to get under control, don't agree with that part at all. I think we're making a good effort, and we've made a good effort over the last few months, but we need to keep moving forward with that, Gotti.
And Dr. John, when it comes to deaths, the latest forecast from the CDC is showing an uncertain trend leading up to October 10th that could bring the U.S. death toll up to 218,000. That's an additional 18,000. What do you think about that forecast?
And these are all models, and these are all predictions, but the predictions so far have panned out pretty well. And if you remember back in March, Dr. Birx, who is part of the coronavirus task force, she said 200,000 cases by October if we did everything perfectly. Well, we're in September, we've gotten at 200,000 cases, and we know we really haven't done things perfectly up to this point. We've done a lot of things that didn't work as well as we'd like them to. We haven't done some things that we probably should have done, but we have that 200,000 number that they were expecting in October. Now they're talking even higher numbers by mid-October. Chances are we're going to start reaching those. And that's that second wave. Just a while ago, I was talking about the first wave not being over. The problem is that second wave is going to start hitting here very quickly. And so instead of having one wave where we get under control, the second wave comes in the fall like we thought it would. Now we're going to have both waves coinciding, and that's going to cause an increase in cases. And unfortunately, every time we have cases increase, we have deaths increase as well. Luckily, those deaths aren't increasing quite as rapidly as they did back in March and April timeframe, but they're still there. They're going to continue to be there, and we're still not out of the woods here. We still have many, many months to go to get this under control, to get the pandemic taken care of, Gotti.
Dr. John, I know last week we talked a little bit about the guidance whiplash that we see from time to time, and then the CDC posted new guidance Friday suggesting that COVID-19 can spread through the air and beyond 6 feet. The CDC website now says that language was drafted or posted as a draft, and it was some sort of error. What do people need to know about how the coronavirus spreads?
And I think the bottom line is the coronavirus spreads through the air, first and foremost. It's a respiratory virus. That's the main way people get it. It can spread through contact. It can get in your eyes, but those are less likely ways of it happening. So spread through the air is the main one. And now beyond that, the semantics have come down to respiratory droplets, which are larger droplets, and aerosolized droplets, which are much smaller. The difference there being the respiratory droplets don't go as far, and that's that 6-foot social distancing we're talking about. Masks can control those better. If it's aerosolized, it hangs out in the air longer. Masks aren't quite as effective, but they still work fairly well at keeping it under control. And so that's the difference there, a little bit of a nuance. Now, what happened here is the CDC, I think they were looking at changing a few things. The wording got out onto their website before it was fully vetted, so they retracted that, or at least took it down. And my guess is they're going to probably start looking at it again to figure out what they want to do. But the World Health Organization has said that those aerosol droplets are part of the way it moves from person to person, but they're not the main way it moves. And so I think the thing for most people to realize is it spreads through the air. We know that. We have to be very careful, that 6-foot distancing, but that's not enough. Masks as well, especially if you're around other people that aren't inside your quarantine circle. That's important because, again, we know it spreads respiratory droplets. We know it spreads aerosolized droplets. What we still don't know is how much of each one is the factor. We think respiratory droplets are the bigger factor, but these aerosolized ones come along. But the concern is, and Gotti, you brought up a great point, and we talked about this last week, is the public trust is a big issue, and that public trust gets eroded every time there are mistakes like this in the sources that should be giving us the information. And so hopefully they get that under control, and we get that one bit of information each and every time we need it that is accurate, that is scientifically driven, that is data driven, and that doesn't constantly change day after day.
Yeah, semantics is something that everybody dreads, but it is something that you're going to see from time to time with uncharted territory. Thank you so much, Dr. John, for breaking that down for us.
You bet.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.